Good morning, everyone. How's everybody doing this morning? Oh, great. Isn't it just a wonderful morning, a wonderful spiritual morning? The rain, it's cleansing our souls, our spirits, our hearts, our minds. Oh, how wonderful that is. Good morning. My name is Yolanda Whittington, and I am your mistress of ceremony today for the conference, and I am happy to be of service to you. I'd like to thank the Spirituality Planning Conference Committee for allowing me to serve in this capacity. It is certainly a pleasure. I would also like to take this time to welcome new and returning attendees. For those of you who are here for the first time, you are in for a wonderful treat. For those of you who had the opportunity to join us yesterday, didn't we have a ball? Wasn't it great? Oh, it's so exciting. It was just so exciting. So I'm happy to be here again for a second day. I'd like to do some acknowledgments, and then I'll talk a little bit about some logistics, and then I will introduce our speaker, actually a representative from the Clergy Advisory Committee. So let me start with a few acknowledgments. I'd like to, first of all, acknowledge the Spirituality Conference Planning Committee for all of their great work and everything that they've done to make this a wonderful and very successful two-day conference. I'd also like to acknowledge and thank Reverend Cecil Chip Murray. His keynote address yesterday was wonderful. It was quite thought-provoking, so I'd like to acknowledge him. I'd also like to acknowledge Rabbi Edward Feinstein for his inspirational keynote address. For those of you who remembered that yesterday, it was quite inspiring. Also like to take a moment to acknowledge all of our workshop presenters as well for their shared wisdom and commitment to the journey of integration of spirituality and mental health. I'd also especially would like to take a moment to acknowledge and thank the Department of Mental Health for embracing the journey of integrating spirituality and mental health. Also, if you haven't had a chance to visit our community resource tables outside in the corridor, we ask that you do that. Visit with the representatives from our various agencies and learn about the various resources in our county. In terms of some logistics, we have a few. The restroom or restrooms are located outside the door to your left. Also, we have volunteers who will be wearing badges with pink dots on them. So if you have any questions, please take the time to call one of the volunteers and they will assist you. They'll also be in the various workshops today as well. In terms of CEUs, please make sure that you sign up at the CEU table outside the corridor. One other thing, I believe we have one of our attendees who is missing a conference bag, or actually there may be two of our attendees who are missing a conference bag. So if you happen to come across that, if you'd be so kind to just bring it up to the front to me so that I can make sure that they receive it. Also, one of our attendees is missing an umbrella, so if you'd be so kind to bring that up as well. Of course, that's very needed. Well, I'd like to start off by introducing Mr. Edward Vidaurri. He was your Masters of Ceremony yesterday. Mr. Vidaurri is the District Chief over Service Area 4. He joined the Department of Mental Health almost 20 years ago as a psychiatric social worker. He has since then held administrative positions supervising other social workers, developing programs like Healthy Families, and providing support to the development of the Dual Diagnosis Program. Mr. Vidaurri co-chairs the Clergy Advisory Committee and has emceed the annual Clergy Conference for years. Please join me in giving a warm welcome to Ed Vidaurri. Ed?
Thank you. I'm simply here to speak for just a few moments on behalf of the Clergy Advisory Committee of the Department of Mental Health. The Clergy Advisory Committee was an idea of Dr. Southard's, in which he conceives the idea of us having the ability to consult with members of the clergy in our efforts to integrate spirituality and mental health. The committee is made up of some clergy people, some people who are members of the department staff, and then other interested persons from providers, consumers, and family members. This committee is constantly in evolution, with new people coming in and people going out, and it plays a part in helping set up the conference every year by giving its input. Yesterday we did have a wonderful day, and we're so happy to have so many of you here with us again today. If you were not here yesterday, let me just say that we expect today's program to be just as good as the one we had yesterday. Different, but good, and with a lot of rich offerings for you to enjoy. We also want to recognize that so much of this conference is due to the consumers, some of whom are here and some of whom are not, because it was the consumers themselves that awakened us, the mental health professionals, to the importance of spirituality in the recovery process. We had a great turnout. You may or may not know this, but we really sold out and had to turn people away this year, even though we expanded to 2 days. And that's great to see that so many people have an interest in spirituality and integrating it with mental health. So I want to thank you all for being here. I want to welcome you for being here. And I want to introduce Kumar Memon, who is a co-chair on the committee with me, but who is also the county-wide representative of Los Angeles County to the Spirituality Initiative, the Mental Health and Spirituality Initiative of California. Thank you all very much.
Good morning. Thank you, Ed. Let's give Ed a big hand. Not only did he MC, but he also chairs our Clergy Advisory Committee. Good morning, everyone. My name is Kumar Menon, and I'm standing before you as the county liaison to the statewide initiative. It's a privilege. Thank you, Dr. Southard. I'm honored to introduce two people, two esteemed colleagues of mine on the statewide initiative today. What they do gives me hope. Their work inspires me. Some of you may already know the first person I'm going to introduce. That's Jay Mahler. I first met Jay last year, right before this conference in the same venue. And Jay was introduced to me as the founding power behind the initiative. And I've never heard of Jay before that. And I was wondering why. Soon I found out why I never heard of Jay. He's very, very modest. In fact, he didn't want this introduction. We had to actually pry information from him to put it in the program. Jay, thank you so much. Jay is an advocate who very gently and calmly will say in a meeting that he will discuss the issue with the head of the department of the state. Now, many people will say that, but Jay actually does it. Many people may talk to the head of the department of the state, but they may not get listened to, but Jay gets listened to. And it's not just the head of the department of the state that listens to him. Many leaders up and down the state listen to him. In fact, the proof is this 2-day conference. It's because of the initiative that we really expanded our 1-day conference to this 2-day conference. Thank you, Jay, for doing that. Jay currently serves as the Consumer Relations Manager for Alameda County Behavioral Healthcare Services. He has served as a board member for the California Institute for Mental Health since 1999. He has served as a board member for the California Network of Mental Health Clients and the National Association for Rights Protection and Advocacy. For over 37 years, Jay has played a quietly powerful role in California in implementing major programs and systems transformation, including consumer-operated programs, patients' rights programs, recovery visions, and campaign for social inclusion. In short, Jay, we cannot do without you. We need more of you. Let's give Jay a big Los Angeles welcome. Now let me introduce Reverend Laura Mancuso, also a member of the initial spirituality group that Jay founded in 1999 in Alameda. I met Laura also the first time last year at the same meeting. And she was one of the first persons to speak in that meeting. I was instantly engaged. Her warm, welcoming countenance, and you'll see that in a few seconds, her calm voice and the beautiful way she expressed really conveyed a deep sense of the spiritual. Laura is genuine through and through. The person you see and interact with is who she is. Since that meeting, I've participated in many meetings with her. Laura's leadership has been invaluable. She has always been the voice that kept us in balance, focused, mindful, respectful, thankful, and in the right spirit. Thank you, Laura, for being you. Laura is currently the director of the California Mental Health and Spirituality Initiative. She earned a master's degree in rehabilitation counseling from Boston University and has been a certified rehabilitation counselor since 1990. She's a trained spiritual director and graduated from the Chaplaincy Institute for Art and Interfaith Ministries in Berkeley in March 2008. Laura is an ordained interfaith minister who strives to honor all faith traditions as well as the spiritual paths and life philosophies of those who do not adhere to any religion. Laura served as the Director of Technical Assistance for the National Association of State Mental Health Program Directors and was a dedicated advocate for inclusion of people with psychiatric disabilities in the Americans with Disabilities Act and its accompanying regulations. Laura traveled to 20 states to train over 8,000 consumers and family members, service providers, and businesses about reasonable accommodations for workers with psychiatric disabilities. She also served for 14 years as project manager with the County Mental Health Department in Santa Barbara. She's the author of numerous articles and reports. She has published in the Journal of Applied Rehabilitation Counseling. She has done reports for California Department of Mental Health, California Association of Local Mental Health Boards and Commissions, California Mental Health Planning Council, CIMH, CMHDA. Laura is a member of the National Advisory Board of the Research and Training Center in Psychiatric Disability and Self-Determination at the University of Illinois at Chicago, and serves on the Executive Committee of Healing in America. We certainly need a lot more of Laura as well. Thank you, Laura, for visiting us to tell us about the initiative. And folks, let's give Laura a big Los Angeles welcome. Let me invite you both up here to start.
Well, as you can hear, I wear a lot of different hats. This morning I was wishing I had one that was about this wide as I walked from the car to the building to protect me from the rain. I live in Santa Barbara County, so we're actually very, very grateful for the rain, given the fires that we've had recently. That notion that our mistress of ceremonies spoke of the washing, the cleansing, is very deliberately needed in Santa Barbara. I want to thank Kumar for being with us at the state level over the past year. You know, we kind of arrived at the conference last year and had all kinds of ideas about doing a conference like this in Northern California. I'm extremely grateful to you all for inspiring us to do that and to complete it, which we did Monday and Tuesday of this very week. And Kumar has been a key member of our statewide initiative. Also Rocco Cheng from Pacific Clinics, who's been with us from the very beginning, and a great contributor and a great support to me personally in the role. And Adrian and Karen Goldberg have also been involved in innumerable phone meetings with great patience and grace, and thank you so much for that. One of the things I was asked to do this morning is to have a little bit of centering, to take just a few minutes to help us center ourselves. We had some very beautiful presentations at the opening yesterday, and we have a little less time, but I am up to that challenge. I am looking forward to that. So I'll be doing a short meditative opening and then turning it over to Jay to begin our presentation, and I'll be back to complete it. So I invite you to put your papers aside and put your pen down. Of course, make sure your cell phone is turned off. Rabbi Feinstein talked yesterday about the need for significant moments. I think he called them authentic moments of connection with other people. And I want to invite you to take a minute to rid yourself of distractions and experience this within yourself and with others. My introduction is a little bit similar to what Reverend Murray did yesterday, but my personal faith tradition is Quakerism, so somehow I always find a way to work silence in. So this is my chance. I'm going to read to you a brief meditation from a book called The Power of Now, which many of you may have read, by Eckhart Tolle. You may close your eyes if that's comfortable for you. Direct your attention into the body. Feel it from within. Is it alive? Is there life in your hands, arms, legs, and feet? In your abdomen, in your chest? Can you feel the subtle energy field that pervades your entire body and gives vibrant life to every organ and every cell? Can you feel it simultaneously in all parts of your body as a single field of energy? Keep focusing on the feeling of your inner body for a few minutes. Do not start to think about it, just feel it. The more attention you give it, the clearer and stronger this feeling will become. It will feel as if every cell is becoming more alive. And if you have a strong visual sense, you may even get an image of your body becoming luminous. And when you've had a moment to rest in that place, I invite you to open your eyes and come back to this room. And I want you to rise from your seat and, still in the silence, find two people in this room that you've never met before. And I ask you to greet and honor them without words, in whatever way is comfortable for you given your cultural background. That may be a slight bow, it may be meeting their eyes with love, it may be a hug, whatever's comfortable for you. So go out and find two people nearby and give them a genuine greeting. There's a very beautiful small book called Small Graces, The Quiet Gifts of Everyday Life by Kent Nurburn, and he says, "We all live in a fear of being judged by others, while the empty space between us is waiting to be filled by a simple gesture of honest caring." And I hope that you've had a moment to experience that. I certainly did just watching you here. Let me ask Jay to speak to you now about our statewide initiative.
Thank both of you for that hug. I appreciate it. I want to also thank the planners of this conference for the invitation to speak on our state spirituality and mental health initiative. There are two areas that I've been asked to talk about. One is the history of the statewide initiative, and the second area is the values, goals, and tasks that the state initiative will be taking on. Before I do that, I want to thank Marv and Edward for acknowledging the role that consumers have played in getting mental health authorities to recognize the importance of spirituality. The person from LA that to me is the most deserving of Marv's gratitude is Pearl Johnson. How many of you know Pearl Johnson? And I've known her for years and years, of course, before she passed. And Pearl was not only a spokesperson in LA, but throughout California and across the country on the consumer movement. And every time she gave a presentation, she would always include that this is the day that the Lord has made. Let us be glad and rejoice. And so let's remember Pearl Johnson. For me, I spent 10 years in mental health treatment from 64 to 74, 5 of those years receiving treatment that no human being in any society should have to endure. I'm talking about being locked up for months at a time, getting shock treatments against my will, being in restraints and seclusion for days at a time. At age 20, I was diagnosed chronic schizophrenia, undifferentiated with prognosis poor, because I didn't respond well to the treatment. One of the most devastating things for me about those experiences in the system was my spiritual experiences and realizations were totally denied, devalued, and even pathologized by the public mental health system. Every time I had an altered state, there was a profound spiritual component to it. And I, of course, have met hundreds upon hundreds of consumers over the last 37 years that have also had meaning in madness. And so I know David Lukoff will be giving a talk about that today. I hope people will have a chance to go to his talk. As I talk about the history of the initiative, I want to share with you that some of my magical thinking, what many people may call pathology, to me is really spiritual awareness, so I may share some of my magical thinking. I personally believe that if a person is fulfilling their God-given purpose, that signs will be put by God along the way to make sure you're on your right path. And so I actually had the opportunity to be in the right place at the right time with the right people to help start the statewide initiative. That to me was a sign. And there are several important factors historically that have gotten us to the point where we can have a statewide initiative. Certainly the hard work and dedication of people and organizations that have worked for years and years to plant the seeds, to lay the foundation that we can now have a statewide initiative on mental health. To give you 2 examples, at the Northern California Conference, we honored Gunnar Christensen. How many of you know Gunnar Christensen from FaithNet? We honored Gunnar Christensen who over 16 years started FaithNet as part of CAMI, the statewide organization, and what he has done over 16 years to reach out to faith communities, to get faith communities to be more welcoming, certainly planted a lot of seeds. And the second example I will give is your own conference here. Having a clergy committee for 8 years, having a conference for 8 years has certainly planted a foundation. And I'd like to give us hands, acknowledge Gunnar and what Los Angeles has done for the last 8 years. Now, another historical reason for why we're at the place we're at now is the paradigm shift from an authoritarian medical model of the 60s and 70s through the psychosocial rehab model of the 80s and 90s to now the recovery vision that's holistic in its approach and has really opened the door for us to embrace spirituality. So that's another historical significant event. And of course, another historical significant event is the passage of the Mental Health Services Act. And thank all of you that voted no on 1E. But anyway, to have the resources now to really do transformative kinds of things that will help change our system. 51 of the 58 county mental health directors have donated to this statewide initiative, and we have the Mental Health Service Act dollars to thank for that. And I also, in my own magical thinking, I believe that the economic crisis that we're in right now is an opportunity. I know it's going to be hard times for a lot of folks, but I think this is going to have to put us in the position we're going to have to engage faith communities. We're going to have to engage the natural communities. We're going to have to throw away the old stuff that doesn't work and bring on the new. So even in these hard times, I believe we'll have a chance to really move forward on this initiative. And certainly a lot more people are praying now, aren't they, with this economic crisis? So we know that's going on. So in 2006, I had the opportunity to be with the right people in the right place as 20 of us that reflected various faith communities, reflected family, consumer, professional perspectives, reflected ethnic diversity, got together for over a year to start planning a statewide initiative. And after a year of planning, we came up with a concept paper, and we all agreed that for this initiative to be successful, we need to make sure that
It was housed in the California Institute for Mental Health, which is the main training arm for the mental health directors, in the Center for Cultural Multicultural Development, because again, the ethnic diversity is so key. So, so we also now have a statewide committee. Laura mentioned Rocco Chang and Kumar Menon, and I think Patty Blum. Maybe they could stand up if they're here. Rocco and Kumar, if you could stand up, and Patty Blum, David Lukoff, and Laura and I are 6 of the 8 members. I hope you'll get a chance to talk with us during the day. Also, each mental health director has appointed a liaison to the statewide organization. Each major provider, consumer, family organization also has a statewide representative, so we've really been organizing at the state level. Now, I kind of want to go over the goals of the initiative. The goals and a progress report are in your training materials. I hope that you will read that carefully over the next few days to get a sense of the statewide initiative. But I want to read to you the goals. I'm going to read them word for word because we spent a lot of time wordsmithing, making sure we had it in a way that was the most sensitive to people. And this is a living document, so we're going to be open for change. But let me read to you verbatim the goals. The first goal is to increase awareness of spirituality as a potential resource in mental health prevention, intervention, and recovery. The second goal is to address the capacity of mental health service providers in California to prevent mental health problems and to support individuals and family in recovery by including spirituality as an aspect of cultural competency and natural support systems. The third goal is to encourage collaboration among faith-based organizations, mental health service providers, clients, and families in combating stigma and reducing disparities in access to services for diverse populations. And the fourth goal is to provide technical assistance to mental health service providers on how to utilize spirituality as a resource for prevention, early intervention, and recovery while preserving client-family choice and respecting the separation of church and state. We also came up with a list of 8 values, and I would like you to read those to you to get a sense of some of the most significant principles in our initiative. The first one is respect for ethical and legal boundaries. There are barriers, including political, legal, and cultural, between the public mental health system and spirituality and religion that need to be carefully and respectfully addressed. 2, spirituality includes but is not limited to religion. Third value, spirituality is a core component of cultural competency. Fourth value, spirituality is a part of a holistic approach to mental health. Fifth value, spiritual experiences can occur during altered states. Some people experiencing altered states with a spiritual component that can support the journey toward wellness and recovery. This spiritual experience as part of madness can be a life-changing event. The sixth value, engagement of faith-based organizations. Faith communities and spirituality can be a source of coping and social support for those struggling with the impact of mental health issues, poverty, homelessness, loss of meaning and purpose, stigma, and isolation. Seventh value, the paramount importance of client choice. We are passionate about choice, including individuals' and families' choice not to engage with spirituality and recovery. I can't mention that enough, the importance of being non-judgmental, to accept each person wherever they're at and go with their flow. The eighth value, a need for networking and technical assistance between county mental health authorities and faith-based organizations. That goes both directions. I also now want to just talk about some of the tasks of the statewide initiative. The first task was to have 2 major conferences on mental health and spirituality. Again, in Northern California, we had a conference last Monday and Tuesday. Again, over 400 people came. And of course, today we're very much appreciated that you incorporated this annual conference into the statewide effort. The second major task was to survey over the mental health directors over spirituality. And again, we surveyed 50 of the 58 mental health directors to get their sense around spirituality. Of course, the main point was that they recognized that spirituality needs to be addressed in the public mental health system, and they also acknowledged that they haven't done as good a job as they could do to do that. Now, I'll share with you a little bit of my magical thinking, just a little bit more, and this is kind of stretching it a little bit, but we're fortunate that, to me, that Alameda County, under the direction of Mary Thomas, and LA County under Marv Southard is leading the statewide initiative. And to me, it's no accident that their names, Mary and Marv, M-A-R-Y, M-A-R-V, are leading this initiative for the public mental health directors. Another, let's give them a hand. Another little sign for me was where your keynote speaker was Cecil Murray. Our keynote speaker was Cecil Williams, who started Glide Memorial Church, African American, very much the same kind of presentation as Cecil Murray. To me, that's not by chance. So again, that's where my thinking comes from. But anyway, another task that we're doing is a resource website. So www.mhspirit.org is our website. Again, that's listed in your training materials. I hope all of you will go to that. Another task we're doing is surveying family and consumer members. I hope out at the table that you picked up a survey. It's going to be in 7 languages. Again, hearing from families and consumers are critical about this. Another thing we're going to be doing is dialogues regarding spirituality in the community. So those are just some of the tasks that we're doing. In closing, I just want to say that the success of this conference will be measured by what happens after the conference as we implement what we learn. And the success of a statewide initiative on the role of spirituality and faith communities in helping those of us recover will be measured by the lives that change and have better meaning as a result of this statewide initiative. And I'm not talking just about the lives of the consumers. I'm talking about the lives of the professionals, the lives of the family members, and the lives of the clergy that will take on new meaning and purpose as we start getting into this heavily. So again, thank you very much for your dedication. Appreciate your help. Looking forward to working with you over the rest of my lifetime, however long that will be. It's a lifelong cause for me. And let me turn it back over to Laura Mancuso. Again, thank you.
Well, that was an excellent overview, Jay. Just a couple things to fill in a couple of blanks about our statewide initiative. As Jay mentioned, we've been funded entirely by voluntary contributions from counties. We have not yet succeeded in getting any state government funding or any federal government funding. And actually, as it is right now, our funding runs out in September. So as you can imagine, we are hard at work trying to find creative ways to keep it going. The survey of counties, we released the first findings from that in a presentation at the Northern California Conference, and I just want to share with you that 3 headlines. First, that there really is very broad support among the county behavioral health directors for spirituality. It's not something that we knew or could measure before we had done this survey, but we conducted phone interviews with 53 of the 59 county behavioral health directors, and over 90% agreed or strongly agreed with the following statements. I'm just going to read you 3 statements. Spirituality is an important recovery resource in mental health treatment. Spirituality is an important wellness resource in mental health prevention. And spirituality is an important element of multicultural competency for mental health providers. We had 98% agreement with that last statement. So there's a very broad support. It is not unanimous. There are some directors who are very uncomfortable with this initiative. There is also a sense that we're not yet doing a good job. It's important, but we're not there yet. We don't really have the skill. We're not currently addressing this area adequately. We're not demonstrating sufficient respect for the spiritual lives of clients and their families. And there is a lot of disagreement about what is the best path from where we are now to where we want to be. And a variety of different concerns about that. Jay mentioned a few of them. And I'll say that many of the directors felt that their staff just have discomfort with this area, and that they as directors were uncomfortable expecting more of their staff without preparing them better for those roles. We have boundaries we need to respect with respect to, say, sexual contact, prohibiting that between clients and the providers. We have boundaries around confidentiality. We have to get more explicit and get down on paper some of the boundaries so that we're not pushing a religion or a spiritual practice on a client or family member when they don't want that. But also at the same time, how do you support them when they do want your help with that? And it is supportive to them. Some ways that you can be involved in the statewide effort: if you can encourage clients and family members to take the survey that Jay mentioned. It's outside right now in English, Spanish, and Vietnamese. And by the end of the month, it will also be translated into Hmong, Tagalog, Cantonese, Farsi, and Russian. And it will be available online at the website that Jay mentioned. It's also documented in your materials, mhspirit.org. And I want to thank Los Angeles County, Riverside, Santa Clara, Butte, Sacramento, and Alameda counties for providing the translations. You can join our email list. That's a second way to be involved and to get news about what we're up to. We promise not to spam you. We send about one message a month, and we do regulate that just to keep you up to date and to tell you about things like free training teleconferences that we offer a few times a year. And also at the website, it's possible for you to actually contribute resources that have been helpful to you and that you have found useful in the area of mental health and spirituality. It's like a wiki, if you're familiar with that form of a website. So we hope that you will visit there. I want to make some reflections about just the role of spirituality within the public mental health field. I promise you that as you embark on this journey, perhaps you've been on this journey for some time, that it is a path that will lead you to know yourself better and to get to know a lot of people whose opinions you may not agree with. And part of the challenge is to find a way to be okay with that and to work through that, as it is in so much of life. We had some very insightful comments from Dr. Mary Thomas, Director of the Alameda County Behavioral Health Care Services, as she opened our Northern California conference. In addition to quoting Dr. Southard in some of his remarks, she made some of her own remarks. I'd like to share with you what she said. She said, "The whole topic of spirituality often creates a great deal of discomfort in mental health circles. Often clinicians are taught to pathologize spirituality in our clients. In fact, people who are clinically trained will often pathologize that which makes us uncomfortable and that which we don't understand. If we are to promote wellness, recovery, and resiliency, we have to develop a much greater understanding and awareness of these differences so that we don't label them as pathology, whether those differences are cultural, religious, or spiritual." Very wise words from our leader up in Alameda County. It struck me as I was in Oakland Monday and Tuesday that a lot of what we deal with in this field has to do with suffering and with healing. Suffering's not a very appealing word. I looked it up in the dictionary, and it's the bearing of pain or distress. The synonyms are agony, torment, torture, pain, and distress. Those are pretty harsh words. But I do think that that's what we're about, to be unafraid, to be present with people who are suffering, to face what's really happening for them. And I think that there is suffering at the heart of stigma and discrimination at its root. I think there's suffering on the part of clients and also on the part of staff when our services do not engender hope or empowerment, because it makes them feel that what they're doing is pointless. I think there is suffering at the heart of the memory of trauma and the scars that it leaves on a person. There's suffering at the heart of mental distress itself. And I've come to understand that spirituality is a beautiful salve for those wounds. It's not only that spirituality can enrich someone's life in a very general way, but specifically for these wounds, I think there is something very precisely appropriate. Stigma and discrimination, like racism, sends the message to consumers that they are less than somebody else. Being a client of the mental health system can make people feel isolated and lonely. Trauma creates a cage around a person's heart and mind and soul that they must fight their way out of in order to break free. Mental distress brings up the really big questions about self-worth and the meaning of existence. You could not design a better antidote for these things than spirituality. It can give the message to consumers that they are whole, unique, and treasured. Spirituality can restore optimism in staff, clients, and families, and fortify them for the challenging work of recovery. Joining faith-based and practice-based organizations can restore people to a much-needed sense of community. Spirituality can offer a path out of the confinement imposed by trauma and back to the possibility of trusting again. And as we heard so eloquently from both of our keynote speakers yesterday, spirituality can offer really solid answers to the big questions of life. It can promote self-esteem, self-reliance, and a sense of meaning and purpose. Spirituality and religion are not panaceas. They can certainly be used to harm people, and they're not yet welcome in the mental health field, not yet. But if we are thoughtful and diligent and continue to build bridges across our differences, as Dr. Thomas advised, spirituality may be just the thing we've been looking for, a valuable resource for those consumers and family members who choose it, a resource that should no longer be overlooked as we strive to improve our prevention, treatment, and multicultural competency. You are truly pioneers, each of you, for choosing to spend 2 summer days here basking in mental health and spirituality. I'm thrilled to be here with you, and I look forward to walking alongside you in this journey. Thank you.